Thank you. Who or what do you think of when I utter the words Latino immigrant? We're going to get it. One more. No. Do you think of Julie and I? Qué bueno. Gracias. Ah, perfecto. Some of you may think of people crossing the border at night, here to take our jobs, use our social services, and not give anything back. Some of you may think of a charity case, someone who deserves our pity. But what Julie and I are here today to do is to dispel these two stereotypes about Latino immigrants. We're going to talk to you about change. We're going to talk to you about compassion. And we're going to talk to you about community. So if you listened to Pedro's talk earlier, you may already be thinking differently about Latino immigrants because he is a success story. He has created change. And you may be channeling one of our great American gurus, Mr. Fred Rogers, and thinking, these are our new neighbors. And in fact, it's true. They are the newest members of the South Carolina community. The prophecy is coming true, as Dr. Wells would say. So we know from the US Census that approximately 5.3% of our population in South Carolina is now Latino. And that's probably an undercount because not everybody gets counted in the census. But that's a 148% increase since 2000. We have in South Carolina the fastest growing Latino population in the United States. The prophecy is coming true. What comes with Latino adults are Latino children. We have had 192% growth in the past 10 years of Latino children. And who has those Latino children? Latino mothers. And as a Southern woman who was raised by some very other strong Southern women, I can tell you, if mama ain't happy, ain't nobody happy. And guess what? In South Carolina, it's hard to be a happy mom. And here's why. We already know that if we come from the United States, if we come from South Carolina, if we're familiar with our healthcare system, it's hard to understand it. We don't know if we're going to go to the doctor and pay $20 copay. We don't know if we're going to pay $140, if we're going to have to spend $922 in the emergency room one year, or $1,200 the next year, like Dr. Lovelace talked to us about. We do know that reproductive health, and specifically women's reproductive health, is a taboo topic in the state of South Carolina. We have been told in this past year that South Carolina women do not care about contraception. We have been told in the past year that our women's public health issues detract from other public health issues in our state. Dr. Salaney will tell you that's true, right? Look at the data. It shows. It shows in the data. South Carolina is ranked 42nd out of 50 states in women's health care. Approximately 20% of women are underinsured. We know from Dr. Lovelace's talk that we're at the bottom of 17 countries that are developed in infant mortality. Well, guess what, folks? South Carolina is at the bottom of the 50 states in infant mortality. We know that we're not doing well in maternal mortality either, and here's why. 1/3 of women get no prenatal care during the first 3 months of their pregnancy. That's when we can get them into system, see if they have other problems like diabetes or high blood pressure, infections, and get them the treatment that they need so they and their infants can remain healthy. We also know that this epidemic of women's reproductive health being a taboo topic is a national problem. We hear, oh, we want all mothers and babies to be healthy. But I'm going to dispel one of those myths about immigrants using our social services right now. No new immigrants to the state of South Carolina are using Medicaid. Medicaid is the federal program that you heard about that pays for 60% of births in this state. You know how I know they're not using it? Because there's a federal law that puts an embargo on immigrants using social services for their first 5 years that they're in this country. That's if they're documented. If they're undocumented, they will never be able to use those social services. So they're not getting the care that they need. I also know that we were unable to reauthorize the Violence Against Women Act for the first time since 1994. We were unable to authorize that act because some people in this country feel that, we should all be protected from rape and domestic violence and we should have health care. Oh, unless you don't love the right person. Unless you live on a reservation, unless your skin is the wrong color, or unless you were born on the wrong side of an imaginary line. You don't count. So where do I come in? I'm a medical anthropologist, and I do cross-cultural research with pregnant women of Mexican origin. I work in a beautiful state in Mexico called Veracruz. It's a Gulf Coast state. I work inland, just like in Colombia. And I work with communities who send immigrants here to the United States to work. They're called sending communities. I also work in Colombia and in the upstate with communities that receive immigrants. We have jobs that they need. They're performing services for us, and they move here. This is where the women that I work with come from. These are communities I work in Mexico. The first picture shows a slum, basically. So what happens is people come down from the mountains, they come from the countryside in Mexico, and they come to bigger cities looking for work to provide a better life for their family. What they find when they get to the cities is there low-wage jobs, they can't afford the rent, and so they end up in shanties. So then they may move to another city for a better opportunity. They move to another state in Mexico for a better opportunity. And eventually they move to the United States searching for their piece of the American dream. We know that when they get here and send remittances back to Mexico, it improves their lives. The second picture up here is of a house with a stack of concrete blocks on the top. This is a family receiving remittances from the United States, and they're preparing to build a second level on their house. So look at the difference right there in those two houses. The third picture is of a group of people standing in line for social services in a community I work in Mexico. This is a traditional sending community where most of the men have left and immigrated to the United States, and there's only women left in the line. There's very few men. And that's traditionally what we see and what we think of are the men immigrating when we talk about immigration. But that's no longer the case. Now we know that women are migrating. Women are working to support their families here and in Mexico. And so in a pilot study that I did, I took some averages. What's going on with these different families? The women who are still living in Mexico and the women who come here to the United States to create a better life for their family. Well, we know that the average family in Mexico is a family of 3 in my study. Here's why people come to the United States. The average annual income for this family of 3 in my study is $5,700. And the average amount of prenatal care that a woman gets in her pregnancy is slightly over 5 visits. That's considered adequate. In the US, we have a family of 4. The annual income is 3 times greater than the family in Mexico at $17,000 a year. But these women are receiving less prenatal care, just under 5 visits, and that's actually considered inadequate. Why? Number one, in Mexico, they have social services for women of low income. They all qualify. It's not like here where they don't qualify for Medicaid. So they all get social services. They get free birth control. That's why it's a family of 3 instead of a family of 4. They're having more kids here, because guess what? We're not talking about birth control here. We're not giving it away, that's for sure. And so let me tell you a story of a woman in my study to kind of explain this. We're going to call her Carla. Carla and her partner immigrated from Mexico. They left 3 children behind with her mother. They currently live here outside of Columbia in a poor neighborhood with their 2 children. Carla and her partner both work. They both pay taxes. They are not eligible for the services that our taxes pay for. They are living off of $1,100 a month. When I interviewed Carla during her 4th month of pregnancy, I said, "Hey, Carla, have you been to any prenatal exams?" And she said, no. And I said, well, do you think prenatal care is important? And she said, oh, yeah, I had it with my other pregnancies in Mexico. And I said, well, why haven't you been to a prenatal exam? And she said, well, I'm waiting until the 5th month when I can get my ultrasound and see that my baby is okay. And I said, okay, anything else? And she said, well, money's tight, and the visit costs $20, and that's a lot for us because we're sending money back to take care of my kids in Mexico. And we don't have a car, and we don't live on a bus route, and transportation is really difficult. So I went back and interviewed Carla after she had had her beautiful, healthy baby boy. The outcomes were great, and we know that. We heard that earlier. Recent immigrant outcomes are better than people who have lived here in the United States. But if we follow Carla and 5 years down the road she has another baby, we know that her outcomes won't be as good. So I asked Carla, how many prenatal visits did you get? And she said 3. And I said, did you get your ultrasound? And she said, yes. And I said, how much did that cost? $400. Remember, they're living on $1,100 for their family of 4 here and sending remittances back to Mexico every month to take care of her other 2 kids. So this is a problem, right? These are the barriers that my women that I work with in the United States face. Money. They don't know how much the visit is going to cost. They don't know how much the ultrasound is going to cost. They can't take time off of work. Transportation. They may not have a car. They may not live on a bus route. Social support is a big one. This is a family that I worked with in Mexico. I'm just interviewing the pregnant mom, but all the women in her family turn out to hear what's going on. So they leave their families behind. And this is the really sad part. Attitude. This is just a piece of the attitude that my women deal with in South Carolina on a daily basis. And the attitude is bad enough, but this attitude breeds another barrier, and that is fear. So what I want you to do is ask yourselves, as South Carolinians, as neighbors to Latino immigrants, what can we do to change this attitude, to reduce this fear for our new neighbors? And one of the things we can do is we can be a community, and we can have compassion for people who share our American dream. And that's what my colleague Julia is going to talk to you about right now.
So good afternoon. I'm going to test your Spanish skills. Buenas tardes.
Buenas tardes.
That was actually better than the good afternoon. So I could really do this talk in Spanish, right? And you'll all get it? All right, good. My name is Julie, and I'm the founder and director of a community-based organization called PASOs. PASOs means steps in Spanish, and we have 4 components to the work that we do. That one wasn't supposed to show up. Our work is about steps that individuals, families, communities, and that our state can do to help make sure that our new Latino immigrant neighbors are able to be healthy and have the well-being that they desire for their families and that we, of course, desire for all of South Carolina. So what do we do in Spanish? We started with reproductive health education. PASOs began in 2005 after I did some research commissioned by our state health department to look at some of these barriers that Erica talked about and see how they were playing out in the health of Latino moms in the Midlands and also with organizations that really wanted to reach this population. Were they able to? And if not, what could be done to help them better reach the population? So I began, after presenting this research, when Palmetto Health and some progressive folks there said, hey, okay, you've convinced us there's an issue, now go do something about it. So I began with a series of prenatal health classes and quickly expanded into other reproductive health topics and began having conversations with groups of Latino women. And as they began to share some of their stories and their concerns, we expanded into community outreach so that we could reach more folks. We then added on a component of individual help in navigating the barriers and the challenges that you just heard about. And lastly, added on advocacy, and I'll touch on each one of these pieces in just a minute. In 2008, as other health systems around the state began to hear of PASOs, they were impressed mostly with the fact that finally there was an organization that existed that was able to develop trust with our Latino neighbors. And trust was one of the hardest things to get because, as Erica mentioned, that big barrier of fear was almost bigger than any other thing that this population faced. But PASOs, we pride ourselves, me and my fabulous team of about 14 folks and 80 community leaders, on doing things in a way that establishes trust and maintains that trust. So as we begin to expand, we reached out to 13 different counties, which are the ones you see in blue. So what exactly do we do? Breaking it down a little bit, we provide community-based education. So we go to where folks are, where they feel safe, and we provide education in their language, respecting their culture and their traditions, and really, most importantly, focusing on their strengths. And that's really key there because it's a group of people that really bring a lot of healthy habits with them, as you've heard a couple times today, and we want folks to be able to keep those healthy habits in place and even find ways to teach us some of their healthy habits. We teach on everything from teen pregnancy prevention to breastfeeding, domestic violence, prenatal health, and the list goes on. We provide individual navigation and support, so one-on-one help in a safe way so folks can say, hey, I really want to learn to be a better parent and provide parenting skills to my partner so that we can help raise our child right. But I'm afraid to reach out to some of these organizations. How do I do that, and what's the best answer? And can you help me learn the skills to do those? We work one-on-one with folks to help build those skills. We do community outreach. Again, not waiting in our offices at the School of Public Health at USC for folks to come to us, but we go to where folks are and where they feel safe. So the slide you see in front of you is a health outreach event that we had in conjunction with another organization at a Mexican tienda, or a store, where folks were shopping and they were able to sit down and get information about resources and how they could be healthy and achieve well-being. We also work with migrants who are here over the summer. You've probably seen folks that come through during the summer months to pick our fruits and our vegetables. We do our best to reach out to them where they're available, and it's usually while they're working because they don't get a whole lot of time off. And lastly, I talked about advocacy. So we do advocacy in a couple different ways. One, as you'll see in front of you, we sit down with leaders and decision makers in organizations across the state, and we try to help provide a bit more of the Latino perspective on things and how to reach this community and how to provide resources. And we also work on the other side with the community, saying, hey, these are your rights in this state, and these are your responsibilities. And we help to build a bridge that makes the system work easier. On another level, we provide advocacy in speaking up and educating about harmful policies and practices, such as this one, which is our latest anti-immigration bill, SB 20, and the Taco Cid crisis, which is what I like to call it. So yes, we've got 4 components breaking down what we do. It's a little bit hard to explain and understand sometimes. Why? Because we don't just do one thing. We do a bunch of things, and we're trying to attack that problem at all angles because we know if we only concentrate on one aspect of it, nothing's ever going to change. So in 2009, something really, really cool happened that changed the way that PASOs work and changed the way that I thought about the work we do and the people we work with. Our participants who had been receiving services from us, receiving outreach, receiving education, receiving advocacy, began to come to us and say, hey, we really like the work you do, and we want to be involved. And we're like, well, great, because there's not enough of us, so come on down. And in 2009, leaders, grassroots community leaders began to come forward and volunteer in PASOs. So now at the core of everything we do, and every project we have teams around the state of grassroots community leaders that are still facing many of the barriers that Erica talks about, but that are standing up and saying, I want to volunteer to make a difference in my community,
for a job in his field. After about a year of traveling around different parts of Mexico, looking for work, and suffering lots of financial difficulties, they decided that they were going to move to the United States, because many before them had shared that that was where you could pursue an American dream. Daniela packed up a few things, said goodbye to her family, not knowing when she'd see them again, if ever, and moved to the United States. She was filled with excitement. Still had not been able to find work in the area that she had studied. So when Daniela came across PASOs, she said for her it was like a glimmer of hope. She said, you know, maybe this is a way that I can put into practice my skills and my passion and my desire to make a difference. Even if it's not necessarily what I studied, it's a way for me to reach others and to feel like a little bit more of that dignity and that excitement that I had when I left my country. So now Daniela is leading prenatal classes in Spanish in her community. She does workshops in her neighborhood on immigrant rights. She's helping folks overcome the barriers that she faced when she first got here. And perhaps most exciting, she's leading a radio show in Spanish over the Latino radio station where she's telling other people about things that they can do to overcome barriers. Like Daniela, we have many success stories. In front of you, you'll see a slide of 30 Latino leaders, grassroots immigrant leaders here in the Midlands area. The cool thing about this group of people is that when we were recruiting for this group, there was all kinds of immigration stuff going on, lots of anti-immigrant sentiment. We were right between the first anti-immigrant bill that South Carolina passed and the second one. So there's a lot of fear, there's a lot of apprehension among the immigrant community. And we had told our funder that we were going to get 30 of these folks to come forward and stand up and be known and say, here, I'm ready to make a change in my community. We were a little bit nervous that we wouldn't even get 30. However, we had over 70 people. And number 3, if you're not quite ready to get involved at either of those levels, it's okay. There's still something you can do. Challenge your assumptions of what an immigrant is. Challenge your stereotypes and those of your neighbors and your family and your friends. And when you run across a Latino immigrant in your neighborhood, at your church, in the store, wherever it may be, think of the things that we told you. Think about their dreams, their aspirations, the barriers they face, and their excitement of the opportunity not to get something from us, but to give something